if you come in off the street and you're not aware of how unique that personality type is, it takes you a long time to get up to speed as a clinician, where if you do a little educating and self-educating and go, you know what, I'm dealing with an airline pilot, let me see if I can figure out what that world is like and what that personality is. If you get that advantage, then all of a sudden you can accelerate that relationship and accomplish a much healthier environment for them when you get what they're going through.
Welcome to the Colleague Down the Hall podcast. This episode is sponsored by the Collab Oasis Clinical Consultation Groups. Hi, I'm Janine Wolf, and I'm your colleague down the hall. I have a passion for helping fellow therapists get the clinical and collegial support we all need to do this work. And wow, it just keeps getting harder every day. I'm the founder and facilitator of the Collab Oasis Clinical Consultation Groups. I have been a social worker for almost 30 years, and I own a successful solo online private practice. More of us than ever are practicing in solo or online practices, and we all need colleagues to process cases with, commiserate with on those really hard days, and also to celebrate our successes with. In this podcast, I'll bring you insights about trends and changes in our field and sit down with amazing therapists who are doing amazing work. We'll discuss fictionalized cases, ways to practice sustainably, and of course, there will be plenty of laughing. I love laughing with friends. I'm so glad to have you as one of my colleagues down the hall. Hello, everyone. You are listening to another episode of the Colleague Down the Hall podcast. I'm your host, Janine Wolf, and today I am joined by Dr. Janette McMurtrie, who is known by most as a Jill of all trades, a retired captain from American Airlines with nearly 50 years of flying experience. She is currently an instructor pilot at American Airlines Flight Academy, and she has been a chief pilot and check airman in leadership airline. She's also retired as a deputy sheriff from the Los Angeles Sheriff's Department and an ordained pastor. But what's most interesting to me is that she holds a doctorate in clinical psychology with a master's in counseling and psychology and pastoral counseling. She's an expert in aviation issues, trauma, and marriage with over 20 plus years in clinical practice, which is why I wanted to bring her on, because I live in Hampton Roads and Virginia. And we have like the largest number of military installments in the world, I think, here. And I work with a lot of military, and I know a lot of other therapists who work with military, and not just pilots, but the military and pilots. And we'll talk about that in a little bit. But I just thought this is a great way for us to learn from somebody who can help us help clients without creating more harm, which is it's really possible to do unknowingly when you're working with this population. So welcome, Janette. Thank you for coming on today.
Oh, thanks. I appreciate the invite.
Yeah, absolutely. So we're talking about mental health in the world of aviation, and that can be somewhat tricky because people who are not knowledgeable in working with these populations, say a therapist who's more of a generalist, has somebody come into their practice and they're a pilot or they are active duty military or in law enforcement, they need to understand the culture of those types of communities and things that can impact their ability to do their job.
That's correct. I don't think the general public realizes how vulnerable a pilot's career is with seeking any type of mental health. You know, it's highly encouraged to seek it, but up until recently, if you sought out any type of counseling or anything along that line, you were removed from flight status and you weren't eligible for unemployment or any type of disability payments because the doctors recognized that, hey, there's nothing wrong with you. You just need counseling. And so it didn't fall into any criteria. And the FAA, the Federal Aviation Administration, turned around and said, sorry, you can't fly. And they have full access to all records, full access to all counseling notes, and it does not apply to HIPAA.
Right. Yes. And it's sort of apropos. I don't know if you can hear the naval jets flying over my house right now, but they're joining us for today's episode. Yeah. So those are really important things to understand and the nuances of that. But also, just off the bat, what always occurs to me is that, yes, we want to have people who are protecting us, who are flying us places, to be in tip-top shape so that they can do the job to the best of their abilities, which benefits everybody. But I've had experience with people who had something like anxiety or depression in one of these careers, and they couldn't seek help because they didn't want to end their career. And I'm much more leery of having the pilot or the police officer or the sailor out there with untreated mental health issues instead of getting the support they need so they can do their job effectively and appropriately. And that's an issue that comes to mind immediately for me when we come to this topic.
Well, and just to give you a little background, when I was a deputy sheriff, like 25 years, PTSD wasn't allowed in the department. So, and we all know that trauma like shootings and mass murders and things like that, anything violent like that, is going to leave its scars. And law enforcement could not have a diagnosis of trauma. And military, it took a long time for the military to even recognize that PTSD was a real thing. And now they're finally starting to treat it properly. But when it comes to pilots and aviation, the public aspect of it is still very, very well hidden. And it shouldn't be. Most of our pilots came from military backgrounds, and now it's starting to change. But out of all those pilots, at least I'd say a handful of them had PTSD coming in, and they didn't know what to do or how to manage it. And, PTSD is quite manageable and quite curable, actually, if you find out what the underlying cause is. So encouraging pilots to come in and get help has been the biggest battle that I've had for the last 20 years. And it's caused finally some noise in the media so that we can finally get the pilots the help, and that, they're just normal people. They have ups and downs and traumas and marital issues just like everybody else. And if we say you've got to be perfect and you can't have these, then they're resorting to other things like alcoholism and legal areas to try and self-medicate. So we finally have started to pop the door open on this area, and we're starting to get the attention. And the FAA is changing very slowly, but it is changing, and they're getting a lot of pressure from media and the public. So finally, we're getting some results.
Yeah, that's wonderful. That's so good to hear. And it's unfortunate that having to go public with these issues is the thing that makes change even start. What I've noticed in the military families that I've worked with, or the military that service member, that it depends on the command. Like, I know people in certain commands, it's like, yes, therapy, meds. Okay, that's great. We want you to do the best work you can, get treatment. And other ones are like, oh, no way. That's absolutely unacceptable. And I suspect it might be the same thing with pilots.
Well, the structure has been so volatile amongst the FAA physicians that there's no standardization, even though they say they're standardized, and even though it's published standardization. I can personally attest to, if I go to Dr. A is going to say, oh, no way. Dr. B is going to say, sure, go right ahead, you're fine. Dr. C is going to say, well, no, there's a whole different avenue for this progress. And, I recently just did a seminar back in Orlando, Florida, on this exact topic. And in the audience was FAA doctors. You have to go to an FAA doctor. And then if you've got a mental health issue, they have the ability to send it to a special FAA doctor, which is called a HIMSS doctor, Human Intervention Mental Stability. And they have a little bit more training in that. But for the pilots, and let's just use American Airlines as an example. American Airlines has 15,000 pilots.
Wow. Okay.
It's just American Airlines. So that gives you kind of a general idea of how big the pilot pool is in the United States, right? And so if any of those pilots have special events, their file gets turfed to a HIMSS specialist. And there's only probably, I'm guessing, somewhere between 20 and 30 at the max in the United States. And then if that HIMSS doctor goes, well, I'm not sure, it gets turfed to a psychiatrist at the FAA. There's 3 now.
Oh, wow. Yeah.
Up until a year ago, there was only 1.
Oh, my gosh.
The stack was a 2-year delay to get through the stack. Now, in the meanwhile, the pilot has done all the clinical work, solved the problem, off medications or stable on medications, and now the pilot is grounded for 2 years while they review it. It's come down to about 9 months now. They're grounded for 9 more months while they're waiting.
Okay.
But you've got clinicians like yourself and myself saying, this person's fine to go back to work. Absolutely fine. We've got an AME that says, yeah, I know he's fine, but I'm not allowed to clear it. So it goes to the HIMSS, and the HIMSS goes, I'm not allowed to clear it, and it goes up the scale. And so can you imagine what that's like for the pilot who has dealt with their issue, and now they have this crazy ladder of red tape to climb?
So then that's one more barrier to treatment if they understand that that's the process. And I have no idea if they're getting paid or not during that time, but it's not. Okay. Yeah. So that's a huge factor then in deciding whether you're going to even open that door, because who can afford to take 9 months or 2.5 years off of their job with no pay, hoping that the end result is going to be favorable, but not really even guaranteed.
Correct. And that's the issue I've been battling for over a decade. And then that's just one aspect of the battle. The other aspect is because they're in a financial strap for getting help, they want to use their insurance, right? They pay for insurance. But insurance companies sit there and go, well, we'll only pay for this diagnosis or this diagnosis. And if pilot is given one of those diagnoses, they're grounded automatically.
Yeah.
Going to seek help has been a very big detriment because the clinician wants to get paid. And the only way the insurance company is going to allow it is if you give them a diagnosis of depression or anxiety or one of the codes that's going to ground them. And that's just not going to work. And so clinicians started using the adjustment disorder codes, and depending on where the file goes and who sees it, whether or not they keep to go flying. They can ask for all the records, and they can send it up the chain of command, and it can take months for that pilot to clear. So I get clinicians calling me going, well, what diagnosis do I give them? And well, give them a V code diagnosis.
Then the insurance is not going to pay for that with the V code.
Nope.
Yep.
So I've been recruiting pilots, and saying, hey, look, go get help first. That's the primary. We want to help you. Go get help. So if you're going to go get help, pay for it. It's called cash.
Yeah.
And, I give cash discounts and, substantial cash discount. And I won't deny anybody for coming to get help. And I have the financial ability to do that. And it's more of, I want you to get help, and that I know what's not going to trigger in their files. And so, occasionally doors just like being bombarded by everybody in town because they know I will help them and I won't cost them their career.
Okay. So the presentation you gave, was that primarily for mental health providers that work with pilots, or was it also pilots who needed to understand, how to protect their career?
The conference was for pilots, and it was open to both, not the general public, but anybody in aviation. So I had both clinicians and pilots and mental health attending, but it was a pilot conference. So they all had some sort of piloting background, whether they were spouses of pilots or involved in military. The military was there. And the military has a little bit slighter advantage because they don't have to go up the FAA ladder, so to speak. They internal ladder that they navigate, and it's a little bit more user-friendly than the FAA. Now, the FAA has recently developed a committee called ARC, and they're reviewing their whole mental health status and what should be available for the pilots. And so hopefully we get some much improved guidance out of that.
Yeah,
and, you and I both know that mental health, occasionally requires a supplement of an antidepressant type SSRI, and there's only 6 approved, period, for pilots. You take anything else other than the 6 approved, and it's not going to work. When we're talking the 6, we're talking Prozac, Paxil, Zoloft. These drugs have been around for centuries, right? Mm-hmm. In my opinion, there's a lot more better drugs out there, but because the FAA wants a 20 to 30-year study on every drug that they allow pilots to take, they're stuck with these old drugs, and they're not the most effective, and they have a lot of side effects. So I'm not a fan of that at all. And if they have to take a Prozac or a Paxil or Zoloft or anything, you and I both know, you get a startup dose, and you have to work your way up to the maintenance level of dose that's going to work for you. Well, if you start taking those drugs, you've got a 6-month period that you have to show stabilized at the level that you are going to require. So all that startup time does not count.
Wow.
The clock's your maintenance level. When you hit your maintenance level, great. 6 months, then you can submit your packet to the ladder, and in 9 months later, they'll approve you back to work.
Yeah.
But if you increase your drug whatsoever, and we all know that there are times in this life when we have to increase that drug momentarily,
yep,
you have to start the whole clock over again, and you're grounded again.
Wow. Yeah, so many barriers. And we're 2 people having this conversation that has all that background information about what treatment can look like, what medication can look like, what are all the things that can help somebody. For, a pilot, someone with these restrictions, they don't know all of that. So I imagine they don't even feel confident. Is there someone I can ask these questions to? Can I safely even inquire about this?
Right. And I've spent my career as a clinician going around to the different organizations within aviation, the unions, and they all have internal peer support, non-trained peer support, I'm here to listen to and train them that, hey, I'm out here for consultation and, give you guidance on how to proceed, and let's get them the help they need. But, clinicians need to be aware that every note they make in their file has to go through to 1 or 2 or 3 different FAA doctors. And even a word such as depression or anxiety will trigger a flag and take the pilot out.
Right.
So be very careful as clinicians what we're documenting.
Yeah, and that's something that comes up all the time with the therapists that I interact with, especially the newer therapists. We are trained typically about documentation if we do an internship or a practicum, and based on the quality of their documentation, you can get a good education around that or not. And, in most of the programs, graduate or doctorate level, they teach you the basics of note writing, but the actual experience comes from where you're working. And if it's a terrible experience, then there's so much insecurity about it. And so that makes it really difficult. So you already have a person who's struggling with doing their documentation in a way that's going to be appropriate, that insurance is going to pay for it, that if somehow this case goes to court, what is a lawyer going to say? There's all these people sitting on your shoulder when you're writing that note. And then on top of it, this is another nuance that really complicates the work that we're doing.
Right. Absolutely. And we as clinicians had to go through our own counseling in order to get our licensing, right? And so, I had to sit down with my counselor and lay out, and, back in the day, nothing was allowed. And I had to lay out everything and said, look, before we even start, you have to agree to this because I'm a professional pilot. Mm-hmm. And she was shocked, but she got it. And,
yeah.
We were able to work within those parameters. But again, the FAA has access to anything and everything, and HIPAA does not apply.
Yeah, that's so important to know because most of us just really rely on HIPAA being the thing that protects our clients and their privacy and their, medical documentation. And so HIPAA does not apply at all. That's very important to know.
Yeah, very important. And most of the clinicians that I've ever counseled, mentored, they've all gone, well, HIPAA. Now I'm going, no, it does not apply. A pilot, when they apply for their medical license to fly, says they waive all those rights and everything is public record. Everything is public record, including your counseling notes. So there's only one or two ways around it. And that's they're coming in for self-improvement. Marital issues can work a way around it, depending on whether or not the pilot has any history of other diagnoses, but come in for marital help or self-improvement, those are okay.
Yeah. And I've certainly done my fair share of that over the years where I have the active duty person come in with their spouse and their spouse is the patient of record and insurance is being billed for their spouse. And, we're trying to help that way. It gets tricky too, because, especially with insurance, there's all kinds of issues around doing marital, how you bill it, who should be in the room, all those things, who is the identified patient. So that's another complicating factor, but it has been a way that I've tried to assist in the past.
Yeah. And the way I assist it is I just sit there and say, I don't bill insurance. I won't bill insurance, and you're going to get a cash discount. And that's the way it goes.
Yeah.
I've chosen because I work exclusively with pilot group law enforcement in that area. So it's easier.
Right. Yes. And, and there's certainly going to be people that they can't afford the cash rate. And there's going to be, the person seeking treatment. And then there's also therapists who are only insurance-based practices and they're struggling to make ends meet because the insurance reimbursements aren't, that great. So there's so many complicating factors around all of this.
Right. And I have found, and of course, like I said, financially, I don't have to worry about it. I've turned around and told many, many people that, hey, pay what you can. And when you're financially stable again, send me a check. And I've seen checks show up 3-4 years later. Out of the
wow.
Just show up. And I'm grateful for it. But, it's not everybody can do that. If you're surviving on this as your livelihood, then obviously that is not something that you really want to be able to do on a general basis. But
right,
I've do that. But I have found too that pilots that really, really want help and seek help, they'll dig into the savings and find a way to pay. And if you offer a cash reduced rate, it makes a lot of difference. When you stop and think about what the insurance company's paying,
right?
Yeah, I think unemployment pays better.
Yeah, maybe so. So are there other aspects of this that are important for providers to have an understanding of when they're, like I said, there's going to be people who specifically work with these populations, and then there's going to be people at agencies or, generalists who have these people come in, they don't recognize what they need to know. So are there other nuances we need to understand?
Absolutely. You have to understand also, we talk about personality types, and I stay in the psychological personality types, these 16 personality types. Pilots are typically, and we're talking male pilots right now, are typically one type. 85% of the pilots are ESTPs.
Really?
85%. And the female pilot is ESTJs. So,
how interesting.
Very slight difference between the male pilot and the female pilot. But out of that, the world population is only 2% of that personality type. 2%.
Wow.
ESTPs. And that ESTP, 2%, you're law enforcement, you're military, or you're airline pilot.
Mm-hmm.
Isn't that crazy?
Yeah,
So
it is.
you have to realize you're dealing with a very unique personality type when you're dealing with that group. So in that group, if you don't have any understanding of what that job is like, there are times in that job when you are on the line and you've got to make a split second decision, life or death, and you don't get to make a mistake. You don't get to second guess. You don't get to analyze. You get to just react. And that's what all their training is about, is to react and do it correctly. Well, the problem happens when they go home.
Right.
Now, when they go home, that personality type does not switch off, as you and I both know, right? It stays there. And so the dynamic at home can be very volatile, because what's happening there is the simplest way to explain it is you've got the rescuer. Rescuer personality is the pilot, the law enforcement, the military, the rescuer. Well, what do you think personality-wise they attract to for a mate? The damsel in distress.
Right.
But the damsel in distress is probably not the smartest move to make if you're in that dynamic. You need somebody equally as independent and strong as you. And that's where I see the successes or the failures in relationships is, if you got the rescuer and the damsel in distress, the rescuer goes off to the military, it goes overseas, the pilot goes flying and gone. Now, all of a sudden, the damsel in distress is in hyper arousal from being abandoned, and they're struggling. So we have this personality type that we have to be aware that when we're dealing with, they sit there and look at us and go, you'll never understand it. You'll never get it. What kind of pressure and job I'm under. And so until we turn around and go, you know what? I know what that personality type is, and that's the advantage I have. I have law enforcement and also airline background. So they don't have to spend the time to tell me or educate me on what their world is like. I know their world. And yes, they'll test me to see if I'm really who I say I am, right?
Mm-hmm. Mm-hmm.
We all know our clients all test us all the time to see if we know what we're talking about. If you come in off the street and you're not aware of how unique that personality type is, it takes you a long time to get up to speed as a clinician, where if you do a little educating and self-educating and go, you know what, I'm dealing with an airline pilot, let me see if I can figure out what that world is like and what that personality is. If you get that advantage, then all of a sudden you can accelerate that relationship and accomplish a much healthier environment for them when you get what they're going through.
Right. Yeah. That's interesting. I'm reflecting on the damsel in distress. I work with a lot of special forces spouses, typically wives, and they're some of the strongest people that I know. I think that, does that personality type attract to people who are more similar to them at times as well?
Well, pilots and military and that, they sit there, and that personality type doesn't sit there and look in the mirror and go, what's my ownership in this, right?
Mm-hmm. Right.
A few times it's really difficult for them to look in the mirror and go, what's my ownership in this? So they'll sit there and they'll say, well, it wasn't me, it was them. And then without looking in the mirror, they'll go back out and they'll seek the same personality type again in the next relationship. So it's a cycle that never seems to stop if they get in that cycle
Yeah.
And so, if they're willing to do a little self-reflecting or even educating, you'll find that most of this personality type, it's like, I don't know what's wrong, but if you can help me fix it, great, let's fix it. They want to fix it, right?
Mm-hmm.
And so they're very open to learning. A lot of my therapeutic environment is educating them.
Mm-hmm.
This is what it looks like.
Right.
And, I do a very aggressive therapy model with most of my clients because that's what they want. That's what they're
Yeah.
And they like it. They prefer it.
Yeah. So really working hard at the beginning to get that buy-in, because there's no blood test to show that this is what they're dealing with. There's no, if you do X, you're going to get Y result tomorrow. It's just not that predictable. We know that therapy can have amazing results, but for a lot of people, there's still a lot of skepticism out there about, does it really work? How does it work? What's going to happen to me in the room? All those fears.
Yeah, and my understudy is in neuropsychology, so they love it when I sit there and say, let's talk about what's going on in the brain, and then I'll perk up and, well, what do you mean? So they really like when they can understand themselves that way. What is going on? And it's like, if you do A, your result is B. If you do B, your result is C. And so when I incorporate that educational aspect to it, they like that. They buy into it. But
Right.
Not trained to do that.
We're starting to see more and more of that, I think, in our field around really understanding neurobiology and the functioning of the brain and the different parts of the brain. So I think that's a wonderful shift in our field because more clinicians are accessing that vocabulary, which is only ever a good thing. Now, it could be intimidating to certain clients, but a lot of clients want to know, like, oh, this person really does know what they're talking about. They're not just going to sit here and listen to me and never say a word, which is not a good type of therapy, in my opinion.
No, but it was old school, and I definitely broke the mold on old school therapy, and it was not good. But if you go to a very interactive relationship with this particularly personality group, you get better results.
Right. Okay. Good. Well, those are helpful tips and things to be aware of. Are there resources out there other than consulting with someone like you? Are there books or papers or websites where people can access more of this type of information?
Well, right now it's very limited, and we're starting to see a little bit of buy-in. I currently trying to write the book on it, but I stay so busy, it's hard to turn around and sit down and write it. I'll have to do what I did with my dissertation, and it's just take a month off and go write the darn things.
Right.
Yeah. But as far as resources, we're starting to see the unions, which most pilot groups are unionized now. So ALPA, AOPA, and APA, all these professional unions that the pilots belong to, and the groups that in 99's Women in Aviation International, all these groups that are out there to help everybody are now starting to have a mental health aspect to, it's like, hey, you need some help, let me send you where to go and who to see. And so we're starting to see a lot more guidance and direction from these organizations, and that's part of what I do is I run around and do a lot of keynote speaking and public speaking at these organizations conferences, so that the word gets out. We start to help pilots and help military and help law enforcement in areas that wasn't obtainable before.
Right. Yeah. That's so important. And in my mind, I'm thinking there should be like an anonymous hotline where someone could call in and say, where can I get some support? To make it really accessible to somebody.
Well, we do at American Airlines. We have what we call Project Wingmen, and so pilots and their families can call into that, and they will be they'll be given a mentor at the peer support, non-clinician. And then if that looks like it needs to escalate up, they'll be giving references in their local area of, who they can see and who can help, who is shown their true course and, establish themselves as a good therapist for them. And so, my phone rings 24/7, 7 days a week sometimes. And not necessarily, sometimes it's just the clinicians going, hey, I've got somebody, they want help. I want to help them. What do I need to do? How do I help them? And so, I'll give that guidance all day long and, educate the clinician on what to avoid and where to stay out.
Right. Yeah. That's so important.
So most of the airlines now employers are now developing that. The unions are developing that, and all these organizations out there are developing that. And if you got a hold of, for example, Women in Aviation International, they would probably through various channels refer you, and you end up talking to me. Same with the 99s, Alpha, APA's got so many available, but a lot of the unions will micromanage back through, and they'll get through to me at some point, or I will refer out to local clinicians. But there is no general, where can I get help? Boy, that would be so much easier.
Wouldn't it? Yeah, absolutely.
I'm hopeful that the FAA's new committee actually does something healthy for pilots. And, you both know talk therapy is not hurting anybody.
Right.
And I'm the first one to tell the pilot, look, if you don't belong flying, you're not flying. And that's, I'll write you a doctor's note and you're out. And so they agree with that. It's like, okay. But if they're fine and they're staying in the program and they're working the work, there's no reason for them to be grounded for the 9 months or 6 months or whatever it is that the FAA's. It shouldn't be that way. Yeah, we all know that a depressive episode doesn't mean they have depression.
Correct. Yep. Well, I'm happy to hear that change is beginning. Like most things, I suspect it's gonna be a little bit a while before it's ideal, if we ever get to that point. But I'm glad to hear that people like you are out there raising this issue and educating people and advocating for pilots. And that's such an important role that we have as clinicians as well, advocacy. So that's wonderful work that you're doing.
Well, I hope, everybody that get in touch with professionally realizes that they've got to help me. I can't do it all by myself.
Absolutely. Yes.
If some of the slack for me, I'm
right.
Eventually we'll want to retire.
Yes. Right. Okay. So before we wrap up, I like to ask everybody that if they have a favorite catchphrase or analogy that they like to use when you're working with your clients.
Yes, I do. And it's called, yes, I can. And together we will.
Okay. That's great. That's such a empowering statement. I'm here to guide you and be with you, but yeah, you can do it.
Yes, I can. And together we will.
Yeah, that's wonderful. Thank you for sharing that. Well, it's been really wonderful talking to you today. I'm going to put the information you shared about contacting you in the show notes so people can get in touch with you. Hopefully there are people listening who want to say, hey, I would love to help you, Janette. Let's figure out how I can join this mission of yours. So hopefully we'll get some exposure to that as well, because it's hard to be a one-woman show when you have such a big issue that you're dealing with.
But it is evolving, so that is good. When I started this 20 years ago, it was me, and now look at the force out there. Thanks to publications like yours and others. So it's finally getting some notice.
Yes, I hope so. Yes, I would love to do my part in this as well, because I've grown up in Hampton Roads. I've been around military my entire life. It's such a unique lifestyle. Pilots are the same. It's just very different than any other type of work, any other work culture even. Yeah, we really need a lot of people doing this work.
And, my son-in-law were both military, so I get it.
Yeah. Okay. All right. Well, thank you so much for joining me. For everyone listening, please remember our work is hard, but it doesn't have to be lonely.
Thank you so much for listening to the Colleague Down the Hall podcast. For show notes, links, and downloads, head over to colleaguedownthehall.com, where you'll be able to learn more about getting the clinical support you need and resources to help you work in a supported, sustainable way. If you've enjoyed this episode, please share with your therapy friends and colleagues. Subscribe to the podcast, and if you love this episode, please leave a review.